I am Pooja, and in this segment today, we present you important health issues with respect to the scheduled tribes, or as we call them, indigenous people of India. Let us begin with the first topic that we have for today, that is, of course, the news. Now, the world is celebrating the International Day of the World's Indigenous Peoples, and it is celebrated on the 9th of August every year to sensitize people about the importance of the indigenous tribes. Why are indigenous tribes significant? Because they are very well versed about the places they have originated from. They know how to ensure the security, safety, and integrity of the biodiversity. And because of their incessant passing on of the culture orally through very rarely spoken languages, it becomes of utmost importance for the world to ensure their protection. So that is why this day is celebrated. Yes, before we move on, the theme for the year 2022 with respect to the International Day of the World's Indigenous People is Role of Indigenous Women in the Preservation and Transmission of Traditional Knowledge. Okay, so if preliminary examination asks you this question, do answer it correctly. I have already told you the important data with respect to that. So who are indigenous people basically? Indigenous people are distinct social and cultural groups. This is one of the way to put it. And they have collective ancestral ties to the land and natural resources wherever they are occupying that area, and or from which they have been displaced, because since development came into being, specifically economic development, there was a lot of desensitization about the importance of indigenous people. So displacement also occurred. So in order to make sure that no ambiguity arises, then this was also included. The next sentence after this was included. Moving on. Now, in the world, estimated 476 million indigenous people are there. That is just the 5% of the global population. And in that 5%, 15% are extremely poor, and world's estimated 7,000 languages are spoken by them, which represents the rare 5,000 different cultures. So, in order to maintain diversity in the world, not only with respect to knowledge, but culture as well, we have to ensure that we take care of our indigenous population. Moving on, let's talk about the International Day of the World's Indigenous Peoples, the origin of it. So, as we know it, Article 24 of the United Nations Declaration on the Right of Indigenous People, it ensured that we are well acknowledging the fact that indigenous people are important, and their traditional medicine, maintaining health practices, all was encompassed under Article 24. Also, to access social and health services without discrimination was one of the important points of the article. So, 9th August, in order to make an acknowledgement of their contribution to the culture of the world and ensure that they have all the rights available to them, 9th August in the year 1982 was declared as the International Day of World's Indigenous People. Okay, and this was done by the UN Working Group on Indigenous Population, which met for the very first time in 1982 and declared this day. So, moving on. Now, if we talk about from the perspective of India, we know them by the name of Adivasi or Adivasi. They are scheduled tribes. They are the indigenous people in India are known as scheduled tribes. And B.N. Rao, in the preliminary notes on fundamental rights in 1946, made it very explicitly clear that we as a country after independence need to take care of our indigenous people. The constitutional provisions with respect to scheduled tribe are dealt with in the 5th and 6th schedule of the constitution, and there is an estimated population of 104 million of indigenous people or scheduled tribes in India, and that is 8.6% of the population. There are 705 officially recognized ethnic groups. Okay, this keyword is over here, officially. The number tends to be higher because there are many unofficial groups that still need recognition. Then the area which we see a lot of concentration of the indigenous tribes, it rests in the northeastern states of India, and the so-called central tribal belt that stretches from Rajasthan to West Bengal. And Jharkhand declared 9th August, that is the International Day of World's Indigenous People, as a state holiday. So remember all this. Jharkhand, from where we also get our first president, women tribal president, as in she belongs to Odisha, she belongs to the Odia tribe, she was born there, but as a governor she held the position in Jharkhand. Okay, this graph shows us the states which are having a lot of population of the scheduled tribes. Madhya Pradesh with 15% of the population stands first, and this is with respect to the latest census, last census, that is 2011. Okay, 21 has still not yet been completed. Then other states such as Chhattisgarh, it has 8%. Then we see Jharkhand also with 8%, but 9% we have Odisha, Rajasthan, and possibly Gujarat as well. Then we see in Jammu and Kashmir, Bihar, Uttar Pradesh, Tripura, we have in Mizoram as well, we have mere 1%. So moving on to the next part that deals with the health challenges of the indigenous population. Now we know that apart from being socially undermined, apart from being economically neglected, the indigenous tribes face a lot of health challenges. We will dedicate ourselves towards health challenges part today. So we see in the Lancet of Indigenous and Tribal Peoples Health Report of 2016, India, with respect to its tribal population, had the highest infant mortality rate for the tribal people. We stand just second to Pakistan. That's not a good thing for India. So infant mortality rate means the number of deaths of infant per 1000 live births. Okay, so this is one thing. Then with respect to 2018, there was a report that has been submitted by the Expert Committee on Tribal Health. This report was the report on the state of India's tribal people's health. And this was a joint publication by the Ministry of Health Affairs with Ministry of Tribal Affairs. They made certain points clear to the government that what are the health challenges. First of all, we know that tribal people are basically concentrated in groups in 809 blocks of India. But there are many other population that are concentrated outside. More than half of the tribal population live outside these concentration or scheduled areas, because these 809 blocks, they were declared as scheduled area. Whenever any area is declared as a scheduled area, then the population that resides there gets extra care, extra you can say a dedicated platform for their care. But if more than you can say 5.5 crore people are living outside the concentrated area, what happens to them? They tend to be neglected. So that is the problem. Notification was a little disturbed. Then comes the percentage of excess under 5 mortality among scheduled tribes. As I told you about infant mortality rate, then we must understand that if we compare the data of last 25 years, then yes, infant mortality rate among the STs have come down. So in National Family Health Survey 1, that was conducted in 1988. In the National Family Health Survey of the first one that was conducted in 1988, it was 135. Then after we see the gap of 25 years, now it has come to, in 2014, it was, the data was 57. And you see, as we compare this data, the ST population with respect to under 5 mortality rate and others, excluding SC, STs and OBCs, we see that comparatively the tribal population is having much more infant mortality rate among themselves. Moving on, also child malnutrition shows us that 50% is higher in the tribal children as compared to 42% to 28% in others. And vector-borne and communicable disease is very prevalent among them. Why? First of all, because there is a lack of awareness and prevention is not very well known to them. So, malaria and tuberculosis are 3 to 11 times higher, plus half of the total malaria deaths in India occur among the scheduled tribes. And specifically now we see that how we are dealing with climate change, this will tend to increase. So a dedicated effort, a dedicated block level malaria committees, malaria prevention committees can also be formed. So this is what I have done. I have tried to interrelate how we can overcome the challenges with the solution. Once you see the challenge, because we have to divide our answer writing into challenges, way forward, right? Once you see the challenge, then only you have to think about the way forward. You have to interconnect. Then difficult to treat non-communicable diseases are also on the rise, that not only are physical like hypertension and diabetes, but mental challenges are also there, such as depression and drug addiction that leads to cancer, and suicide are also increasing, and drugs are very easily available to them. So that leads to drug abuse. That is also a problem. Dependence on government agencies for healthcare is a lot. Private sector is not very involved here. And 27 to 40% deficit is there with respect to primary healthcare, because they are totally dependent on primary healthcare and there is a deficit of primary healthcare. Not only that, but human resources are also deficit, 33% to 84% less in tribal areas. Also, they have very few financial avenues to take care of the PHCs, so that leads to lack of morale. No doctor wants to go there if they are not getting paid. If PHCs are not getting proper funds, they are failing to get established in such areas. Participation is also very less with respect to tribal people. We never see them represented with respect to designing, development and implementation of health policies with respect to their own population. So representation is also lacking. And also there is no political will. A very few political clans are actually taking care of the population. Specifically, one thing we have to make clear over here, that until and unless those states which have a lot of tribal population, until and unless they don't do so, they won't be setting an example for other smaller proportioned states. So let's take an example. Why am I saying this? Because let's take an example of tribal subplan, which had the provision of providing a certain amount of funding for their tribal population, but it was completely flouted. Nobody knows. You see, in 2015 to 16, annually 15,000 crore should be additionally spent on tribal health, but there is no record whatsoever of what happened to the funds that were made available. Also, because of the lack of database with respect to where did the funds go, what percentage of population got the funds, what is the database with respect to medical condition, health condition of such population, we cannot, ensure to hope hope for a better outcome, because until and unless we do not have the data, we won't be able to formulate policies. What is the global status with respect to health for indigenous people? Let's see. The international legal framework regarding indigenous people and right to health came into being on 13 September 2007. Where Article 7 says that indigenous individuals have the right to life, physical as well as mental integrity, liberty and security of person. This was first. Secondly, Article 38 says that whenever a state has to implement these particular articles, because there are many other articles, then they have to cooperate with the indigenous population as well. And Article 39 says that indigenous people have the right for financing such declaration by the help of the state. Okay, moving on. Now let's talk about the initiatives that have been undertaken. As I have already told you that 2018 a report was published. The committee for tribal health expert committee was made in 2013. But this is a report from 2020 which said that the recommendations are still not implemented. So this is not a very good thing. Only you see a proposal currently is being discussed that involves addressing only one disease, that is the sickle cell disease, in which the red blood cells which carry oxygen to our blood, it gets misshapen and breaks down and hence causes a very severe anemia. And if this gets fruitful, then 5 lakh to 10 lakh sickle cell disease patients will be saved. And that is just about 0.5% of the total population. So we need more dedicated approach and more integrated approach towards health. But not all is lost, because Niti Aayog is still keeping in mind the plan with respect to how to deal with the health issues of the tribal population. So this is a pyramid. You see there will be one PHC that in public primary healthcare, that will consist of 2 Ayush or MBBS doctors and other staff plus 2 mobile outreach service. Then we see tribal health and wellness center will be there per 2000 population. That will also include other human resources. So we need human resources first of all. For that we need finance. Okay. Then comes one Asha, and expanded Asha will have also an expanded role over here. That is average 250 per tribal village will be provided. Okay. And that will be, of course, many other things will have to come into the picture. So again, finance and human resources. 5+5 male as well as female Arogya Mitras will be created. Those will be youth volunteers to help the indigenous population in each village. And health literacy will also be provided, how to make people aware, tribal population aware of their health. That will be done through mass media, folk art, technology and school as well. And then development programs for social determinants will also happen. That means water and sanitation, Swachh Bharat Abhiyan and other sanitary measures will be taken, and Gram Sabha will be empowered under PISA. PISA is a very important act with respect to scheduled tribes. So under that only Gram Panchayats will take care that community participates. And this is also the proposed governance structure of the tribal health. At national level, National Tribal Health Council will coordinate with Central Health Council and Ministry of Tribal Affairs. Okay, that will be through National Tribal Health Directorate and National Tribal Health Research Center. So once you have the research, then you can implement the policies. At the state level, State Tribal Health Directorate will be created and Tribal Health Council. Okay, that will go down to district level. That will have District Tribal Health Advisory Council. It will advise the superiors about the health issues. And then at the block level, we have Tribal Health Assembly. Assembly will be created at the block level. And then at the village level, Taluka Health Council as well as Tribal Health Assembly through Taluka Tribal Health Officer and Taluka Health Council will work. So this is the proposed plan. Okay. Let's move on and talk about the recommendations which the expert committee made, which have not been yet implemented. To formulate a National Tribal Health Action Plan, mapping should be done. That can be done through survey monitoring, and then we can formulate a health plan according to the disease that is very prevalent in a state. It can happen that pockets of different diseases can form in an entire country. Entire country will not have the same issues prevalent everywhere with respect to tribal health. So if we know the disease, then disease specific programs can happen. So status of health and healthcare at a goal is to what is the goal of this plan? Status of health and healthcare at par with the respective state averages in the next 10 years. This was a report in 2018, yet not implemented. The committee also suggested nearly 80 measures to be included for addressing 10 priority health problems. That also includes healthcare gap. What is the gap between the healthcare? What is the need? That is the demand. And what is the supply gap? Also the human resource gap. How to fund these human resources as well. And the governance problem. What is the governance problem? Then the committee also suggested that there should be an allocation of additional money so that per capita spending of the tribal population can be equalized with the per capita spending of the rest of the population. So National Health Policy of 2017 says that 2.5% of the GDP has to be spent on healthcare. And let's now move on to our prelims based question. I will take the names of those who will answer it correctly in the next segment. For those who have answered yesterday's question, I will take your names today. So whoever has not answered the last question, you can move on to anything else you are doing and do answer this question. Okay. So it says, according to the latest census 2011, which state of India has the highest percentage population of indigenous people? Chhattisgarh, Arunachal Pradesh, Madhya Pradesh and Sikkim. So answer it correctly. I have already told you the data with respect to this question. So I hope that you can answer it. Okay, now first of all, let us move on. For those who have not answered last question, you can move on to something else. Not a problem with that. Let me just take the names of those who have answered the last question correctly. So that was with respect to the collegium system. And yes, many of you have answered it correctly actually. The answer was 2 and 3 because yesterday I asked you which statements were not correct. First was correct, second and third both were not correct. Gautam has answered it correctly. and Indra has answered it correctly. Adarsh, do see that there is a problem with your answer. What is wrong? Just check it out, okay? Deepak Sharma has answered it correctly. Simran, actually the answer was 2 and 3. That is option C. Okay, because we had to choose the incorrect statement. This could be the problem that I am telling you. Then aspirant Khushwant has answered it correctly. Also, Bharat has answered it correctly. Anuj, again, there is a problem with your answer. Just check what is wrong. Prashant has answered it correctly. Mission IAS has answered it correctly. Raghav, Madhusudan, Guru Prasad, Anurag Verma answered it correctly. Then Sudarshan has answered it correctly. Dinesh, Shubham. There is some problem with certain answers that I'm seeing. Please just go back to the segment and watch it again. Satvik has answered it correctly. Prince has answered it correctly. Then again, you see, I don't see. Yes, Yashaswini answered it correctly. Prapti, Saloni, Rahul has not answered it correctly. Sorry, Rahul. See the segment once again. Keshika has answered it correctly, and Prabhakar. So, same procedure we will follow for this question. Thank you so much for watching and stay updated.